Hi everyone, my name is Paige Greenewalt, and today I'm going to be providing a presentation on health disparities and social justice within adults living with physical disabilities. This presentation is for Nursing 312, Human Diversity and Cultural Care in Nursing. By the end of this presentation, the learner should be able to meet the following SMART objectives. Identify 3 society and 3 healthcare related forms of bias experienced by adults with physical disabilities. Explain 3 health disparities that affect adults with physical disabilities and explain how this contributes to poorer health outcomes. And lastly, describe 3 evidence-based strategies that reduce health inequities for adults living with physical disabilities. So an introduction to adults with physical disabilities. Adults with physical disabilities do represent a systemically disadvantaged population because of the structural barriers, discrimination, and inequitable healthcare access. According to the Centers for Disease Control and Prevention, 1 in 4 adults have a physical disability, and mobility impairments are among the most common. Again, some issues that this population may face include structural barriers, discrimination, social inequities, or healthcare inequities, which we will be further reviewing within this presentation. The purpose of this presentation is to examine the bias, health disparities, and inequities experienced by adults living with physical disabilities. This presentation will also explore evidence-based strategies to promote health equity and social justice. Adults with physical disabilities can include those with long-term impairments. Long-term impairments are those that substantially limit mobility or physical functioning. These disabilities can be congenital or acquired later in life, and some examples of a physical disability may include spinal cord injuries, cerebral palsy, multiple sclerosis, amputations, muscular dystrophy, or anything in the muscular dystrophy family, and the list can go on and on. This list was retrieved from the Centers for Disease Control and Prevention. It is also important to note that the disability itself is not the cause of poor health outcomes. In fact, it is the systemic barriers and inequalities. Individuals with a physical disability often require mobility assistance, and this can be anything as a wheelchair, walker, prosthetics, or any other kind of mobility equipment. So the bias in society this population can often experience lower income or unemployment, and they have a greater reliance on healthcare services and mobility needs. So because of this leads to the bias within society, and employment discrimination remains a large problem for physically disabled adults. This can be directly correlated with the high unemployment rates due to the assumptions that employers make about a person's productivity and capability to perform the job. Secondly, many buildings, public transportation systems remain inaccessible. Adding accessible features such as ramps, elevators, wheelchair vans will help limit this bias. And lastly, social stereotyping often makes it seem as though individuals with a disability have a lower quality of life, and this is not always the case. They can live the same life that normal people, or I guess you could say people without a disability, live. This leads to also the bias that is received by healthcare. So diagnostic overshadowing, physicians may blame certain symptoms on a person's disability rather than fully looking into what is causing those symptoms. And in turn, this can lead to hesitancy to receive healthcare in the future. Secondly is inaccessible medical equipment. This includes non-adjustable exam tables, inaccessible scales, or diagnostic imaging that is not wheelchair accessible. In this slide, there is an image of a person who is on a wheelchair scale. So if healthcare facilities start implementing or have wheelchair scales, this will help limit this bias. And lastly, provider attitudes and assumptions. Healthcare providers may automatically assume that a physically disabled person has a lower mental capacity or decreased quality of life. And again, this is not always the case. Research has also proven that preventative screenings are not offered to those who are physically disabled, and this kind of ties in with bullet point number 2, because oftentimes diagnostic equipment is not wheelchair accessible, and some disabled people are not able to stand long enough to receive the test. Also, it is important to note here that these biases do reduce preventative screening rates and can contribute to delayed diagnoses, ultimately tying into inadequate health outcomes. Adults with physical disabilities experience many major health disparities or inequities, and this slide can list a few of those. First, patients often missed or do not get offered preventative cancer screenings. This can be due, again, to inaccessible equipment or transportation barriers. Secondly, according to Healthy People 2030, these patients are at a much higher risk to develop chronic conditions such as obesity, diabetes, or cardiovascular disease. This can be due to these patients not being able to be as mobile as someone without a disability. And lastly, mental health disparities is a significant concern among this population. Studies actually show that rates of depression and or anxiety related to social isolation are much higher. And combined, these inequities lead to poor long-term health outcomes and reduced life expectancy. So some solutions to promote social justice, as we know, addressing these disparities requires some form of change. First, healthcare facilities should ensure that they are meeting ADA regulations and have accessible medical equipment available. Secondly, provider education is a large part of this change. Requiring yearly training can help reduce implicit bias and improve communication techniques among healthcare workers and disabled patients. Continuing on the topic of solutions is policy advocacy and reform. Nurses can play a large role in this, and they do have the capability to change rights and laws surrounding disabled persons at a system level. And lastly, community involvement is crucial. Setting patients up with accessible transportation services can help promote that they are making it to their medical appointments. And also within the community, having adaptive exercise programs that disabled persons can be a part of can help increase their range of motion and increase their independence. Here is some local community resources that are around the Lancaster County area. United Disability can help set patients up with service dogs or personal in-home care. They also help out with getting their medications, and they can help provide life skills such as helping patients find a place of employment. Next is Red Rose Transit. This company has wheelchair accessible vans that can transport patients to and from their medical appointments. And lastly is Bright Star Care. This is another great resource that can assist patients with their ADLs, such as bathing, dressing, or cooking. They can also provide transportation to and from medical appointments, the pharmacy, grocery store, or wherever these patients need to go. And to conclude, adults with physical disabilities face bias in society and healthcare settings. These biases contribute to significant health disparities and decreased desire to seek medical care. Social justice requires provider education and policy reforms, and nurses can play a critical role in this part. Promoting health equity for adults with physical disabilities is not optional. It is a professional and ethical obligation for all healthcare workers. And these are the references that were used for this presentation. Thank you for listening.